So can you tell us about what settings you've worked in and what patient populations, that type of thing?
Yeah, so I've worked in skilled nursing and like subacute rehab, and then
Mhm.
also in schools with younger kids. So that's two very different
Yes.
settings with two very different age groups. Yeah. So those are the
Very
main ones I've worked in.
okay. And obviously they differ by quite a bit, but
Yes.
did you just happen to fall in love with the location and decided to switch to a school or subacute? Or I guess how did you decide to make that transition to a completely different setting?
Right. Well, I think one of the things with travel therapy is it's good to kind of just be open to different possibilities and open to the different settings you're going to work in. So when out of college, I initially worked in skilled nursing. So for my
Mhm.
my permanent job for those years after I graduated college, it was just skilled nursing. That's all I had done in my professional career that far. And and then when I started looking into travel and talking to my recruiter and everything, a school position popped up and it was available. And I kind of thought back and forth about interviewing for it because it was in a nice location in California and I really wanted to go, but I was unsure because I didn't have any experience. I mean, in school, in college, we did like clinicals in the school
Mhm.
settings. But just from my professional experience, I had never worked in a school. So I really went back and forth about if I should go for it or not. But I really wanted to travel and I wanted to go to this place in California. So I interviewed for it and they picked me and off I went.
Okay, so it was kind of or you were doing
Yeah.
it based on the location that you wanted to go to, which totally
Hmm.
makes sense. I think being open to those different settings, whether you're currently working in schools and maybe open to medical or
Yeah.
vice versa, or obviously medical, there's all sorts of settings too.
Oh,
Having
yeah.
that flexibility kind of opens up new locations for you too, which is awesome, which worked out for you.
Yes, it just being open to different settings and stuff, it opens up so many doors and there's so many more possibilities of different places that you can go.
Yeah. So working with all like adult geriatric population and then switching to schools, did you start working with like elementary age, high school, or what age range were you working with?
When I started, I had a caseload of kids all the way from preschool to high school. So it was a big
Oh,
it was a big range.
okay. Were you working at multiple schools there too?
Yeah, multiple schools. I think I covered maybe 8 or 9. It was a big district.
Okay.
Yeah.
But working with like geriatrics and then switching to pediatrics, was there anything that you did to like prep for that? Not having that school experience, or were you
Yeah.
just like, hey, I'm here,
Yeah, definitely. So I, cracked open my textbooks from school, and I kind of brushed up on some school specific, school based occupational therapy things.
Hmm.
Um, and then I also took some like online continuing ed classes. I actually took quite a few before my start date,
Yeah.
just specific to school occupational therapy and
Yeah.
the different like the IEP meetings and the documentation. And so I just those are the two things I did was look at my old textbooks and stuff and then do some online courses to get me ready for a school position since I had only ever worked with the adult population.
Yes. Do you prefer, I guess, now that you've had experience in all ages, do you prefer geriatrics still, or do you like pediatrics more, or do you kind of enjoy both?
I think I enjoy both for different reasons because
Yeah.
it's two totally, completely different settings. So there's like good things about both of them, and I like both. I
Okay.
don't think I could pick one over the other.
Yeah.
But it's cool
uh,
because I would have never known that I did like, school based occupational therapy because I would have never thought about, taking a job in a school, but since travel therapy kind of pushed me towards it, I feel like I'm more skilled now because I
yeah.
have that experience which I wouldn't have had before. So